Specialty Stories, session number 64. Whether you're a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast will tell you the stories of specialists from every field to give you the information you need to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to Specialty Stories. My name is Dr. Ryan Gray, your host here every week. I hope you're having a great week. I want to thank you for taking the time to download this podcast or stream this podcast, however you are listening. Turn it on, put on your headphones, rock out in the gym, rock out while you're doing dishes, making dinner, doing laundry, whatever you are doing. Thank you for being here. Today I have a great guest, somebody who came to me because one of you heard this podcast and heard me say a couple weeks ago and several times that I need more guests. So if you know a physician who you think would be a great guest here on this podcast, reach out to them, give them my email address, ryan@medicalschoolhq.net, and have them contact me, and we'll get them on the show. That is how I got in contact with today's guest, who is a private practice Med-Peds doctor. That's internal medicine and pediatrics combined specialty. Now, Dr. Lauren Kuwik has been out of practice now for 5 years in private practice in the Buffalo, New York area, and she talks all about her journey with us today. Lauren, when did you realize that you were interested in Med-Peds?
I knew a doctor growing up who was a family friend who ended up being my internist when I transitioned from my original pediatrician, and she was Med-Peds. So I had that in the back of my mind as a possibility.
What was it about that specialty that interested you in it?
So I always tell people the first thing I wanted to be was an archaeologist, and the second thing I wanted to be was a teacher. And I feel like Med-Peds allows me to kind of be both. So the archaeologist part of it, with internal medicine, you're always putting together clues to figure out what's going on with the patient. And I love that. I love the mental gymnastics you have to do for internal medicine. And then for peds, kids are just fun. And sometimes when I'm examining like a 6-year-old and getting them to jump up and down, I think, I can't believe I get paid for this, but I love taking care of kids. So kids are fun. The teacher aspect, I love educating my patients on a daily basis. And so, I kind of get to do all the things that I wanted to do together in one specialty. So I like that a lot.
With the subspecialization that medicine is going towards, do you see a risk of Med-Peds, because it's so general with both internal medicine and pediatrics? Do you see a risk that specialty will go away over time?
I don't think so. I mean, we definitely need primary care doctors. And I think specializing in both really gives you the opportunity to be a better pediatrician and a better internist. I think people really like to have someone that they can see themselves, have their mother seen by. We see their kids. The parents buy in more to what we're saying because we're also their doctor too. So I don't think so. I think that there have been some good things that have come down the pipeline for primary care. So I think it's here to stay.
Good. Now, for some students out there who maybe haven't heard of Med-Peds before, but then hear, oh, you're taking care of adults and kids, that's like family medicine. What's the difference there?
Exactly. So actually, some of my family members thought I was just a straight pediatrician until a couple of years ago when they had other people say, your daughter's my doctor. So it's similar to family medicine or family practice, where we take care of the whole spectrum, from babies all the way to, I have some patients who are in the later 90s and 100. But we don't do OB, so we don't deliver babies. We do take care of pregnant patients, but we're not involved in their, prenatal and delivery care. I do very little surgery, and some family practice doctors do very little surgery too, but some do small operations in the office. And the other thing is, whereas they may do a couple months in pediatric training, we do a full residency in pediatrics, and we're board certified in pediatrics. And we can subspecialize if we want to. So any specialty you think about, it really comes out of internal medicine or out of pediatrics.
When you talk about subspecializing, can you subspecialize in either the pediatric subspecialty or the adult subspecialty?
You can, or you can specialize in both. So there are people that, for example, may want to take care of patients who had complex heart disease as a kid. And then those patients were repaired and now they're 30 and they need someone to take care of them. And so there are people who will do a longer fellowship in combined internal medicine and pediatrics cardiology. And then they are equipped to take care of those people, throughout their whole life. It's longer. So for fellowship, if each fellowship in internal medicine or pediatrics is 3 years, that's usually about a 5-year fellowship.
Wow.
And then there's people who just say do adult cardiology, but because they are pediatric certified, they feel very comfortable with those cases. So there's other ways to do that without doing the full 5 years.
Yeah. Okay. Interesting.
That's a lot of training.
It's a lot of training. Yeah. What traits do you think lead to being a good Med-Peds doc?
I think you have to be willing to talk to people, and you have to be willing to build relationships and be comfortable speaking with specialists, because that really will help your patients out in the future. And you have to be able to apply knowledge to things that don't seem very straightforward. Some people like to have one specialty where they get a lot of deep knowledge in a very narrow pocket. You have to kind of know a little bit about everything and be really, willing to work hard. And then the other thing is, if you're someone that doesn't like to do a lot of procedures or like to be in the operating room, this is something where you can do some minor procedures, but it's not heavy. So that, I think, is a good fit as well.
As you were going through medical school and looking at options for residencies, was there anything else that was drawing your attention away from Med-Peds?
I love emergency medicine. I think most people in Med-Peds at some point considered a career in emergency medicine. For me, it was probably a couple things impacted that decision. First of all, my mother's an emergency medicine nurse practitioner, so I went to Bring Your Daughter to Work Day, and I spent a lot of time volunteering in the emergency department, and it's just a ton of fun. There's a lot of variety, but ultimately, I like controlling my time, and I don't mind an emergency every once in a while, and I don't mind dropping everything to take care of it, but I don't want lots of emergencies going on at the same time. I don't like feeling kind of like I'm flustered. And I really like having control over my own schedule and deciding, the hours that I want to work without someone assigning those to me. It gives me more time with my family.
Yeah. What types of patients are you seeing? Are you seeing healthy patients, well-visit stuff? Are you seeing sick patients?
I see a mix. So in terms of my ages, I'll see, like after this podcast tonight, I'm going to the hospital to see a 1-day-old baby, and I had someone who was 91 in the office earlier. I do see a mix of well visits, or what we call annual wellness visits or physicals, people who are getting ready to go to surgery, people who come in for chest pain or for fevers, people who need abscesses drained or biopsies. So it's kind of a variety of things.
Describe a typical day.
A typical day. So I like to get to the office about 30 minutes on a good day before I start the day. And there's a lot that we do between seeing patients. So it's talking to my nurses, answering calls, checking labs, reviewing any documents that came in, images. Sometimes prepping my notes in the morning, although I do that typically the night before. I see patients in the morning for about 3 to 4 hours, do a lot of the same stuff at lunch, just reviewing labs and documents, talking to people. And then I see patients in the afternoon as well. I also have a late day where I'm in the office until about 7 at night, but I come in at noon. So, that's the same day, just push forward a little bit, and I get some more free time in the morning before coming in.
For Med-Peds, it sounds like it's more pretty strictly outpatient based. Although you said you're going to the hospital later to check on a 1-day-old. For Med-Peds, is it mostly outpatient, not doing much inpatient?
At least where I live, it is. I think if my area of the country is similar to other people's practice, most outpatient primary care doctors, whether pediatrics, internal medicine, family practice, or Med-Peds, are having their patients taken care of in the hospital by hospitalists. So I only go to the hospital for babies born to my practice at the newborn nursery. And it's pretty rare, actually. Most pediatricians have the hospitalists in the nursery see their patients. Yeah, so it is 95% outpatient for me.
Do you have to take a lot of call?
I take call 1 day a week. Usually I might get one phone call. One time I went almost 3 months with no phone calls on that day. Sometimes we get, two or three. And then every fifth weekend, I'm on call and I get an average of about 10 phone calls. So it doesn't in any way impact my weekend. I don't have to necessarily be somewhere. I just have to be available by phone. And, if patients hear my kids talking or crying in the background, they know that I'm living my life. And, usually people are pretty nice about it. But it's not that time consuming.
So it's just patients typically calling with issues on off hours for call.
Yes, exactly. Okay. Yeah.
Do you feel like you have enough time for family and life outside of being a doctor?
I do, but I have 3 children. I had 2 during residency. So anything after having 2 kids back to back in residency seems like a ton of time. I mean, my kids were almost 18 months apart.
Oh.
But yeah, I do. So I work a pretty typical day, 2 days a week. My third day, like I said, I come in at noon. I'm here till about 7. Then I have a day off completely. And then on Fridays, we're only open a half day. I'm the one doctor in the office, which makes it very busy, but we only work a half day. So I have Friday afternoons off too. So I feel like I have a lot of time at home with my kids. I'm there with them in the morning to get them on the bus. I get them off the bus 2 days a week. So yeah, I feel like I have a lot of time.
What does the training path look like to become a Med-Peds doc?
So you're taking a 3-year pediatric residency and a 3-year internal medicine residency, and you're smushing them together into 4 years. Because of that, there's a lot of overlap, especially in that first year, about learning how to be an intern. And a lot of the things that you learn are not really specific to one specialty or another. There's not a lot of time for electives or, say, research months. And we have a lot of inpatient and intensive care unit months compared to, say, a traditional pediatrics or traditional internal medicine residency.
If most of the work is outpatient, why is there so much focus on the inpatient and intensive care?
That is a great question, Dr. Gray. I don't know the answer to that. I was thinking about that the other day in the newborn nursery. I was thinking, geez, I only did 1 month in newborn nursery and I did 3 months in the NICU. And my NICU graduates that come to my practice are very few and far between. I don't know why it's so heavy on inpatient ICU months. The other thing I could say is I think in general, probably residency is pretty hospital heavy for most specialties.
Mm-hmm.
One afternoon a week, you're at a long-term clinic, which is kind of where I really started to realize that I really wanted to do an outpatient primary care career.
Is that something that, looking back on your choice of residency, maybe you would have chosen to find a residency that had more outpatient rotations?
I don't know if it's actually something that is modifiable. I think for Med-Peds, there are just national guidelines that you have to hit to both finish your pediatric requirements and finish your internal medicine requirements. So I don't think that it was a modifiable thing. And I felt very lucky because my clinic, quote unquote, assignment was at a private practice in the community where the other doctors are really happy in primary care. And it was really well run and gave me a great introduction to life as an outpatient primary care doctor and really sucked me into that role.
A random question. Do you
Yeah.
know any data that shows that graduates going into Med-Peds residencies choose to end up subspecializing in something and only doing that subspecialty for adults or for pediatrics?
I don't know any of the national data. Locally at my training program, which is one of the bigger programs, these programs for Med-Peds are really small. So I'm from the East Coast. I interviewed at a lot of East Coast places from, like Boston down to DC. And most programs were 2 to 4 residents a year. And 4 was a big program, or 8 compared to like 60 internal medicine residents or 30 pediatric residents. Most people who graduated from my program went into primary care. Or if they did do a specialty, they only did that specialty in internal medicine or say pediatrics. And then sometimes the overlap stuff like sickle cell care or cystic fibrosis care. So I have seen people do both, but I don't know what the national data is. But in my particular program, most people actually run into primary care.
Okay, good. How competitive is Med-Peds?
No, I think not particularly.
Yeah.
I went to a state school and interviewed at, some top echelon programs and felt like I was just as competitive as the other people. So I don't think it was particularly competitive.
Is there, and making assumption, is there a thought that because it's Med-Peds or just primary care in general is not that competitive?
I think, general internal medicine, pediatrics, Med-Peds, family practice, those things are probably not as competitive.
Yeah. Okay.
I wish they were more competitive. I think it probably has a lot to do with salary and reimbursement. But, I think they're the greatest fields in the world, but they're not as competitive.
Yeah, unfortunately. Do you see any negative bias towards DOs in Med-Peds?
I don't. This comes up a lot. My particular residency program was very DO friendly, and I a lot of times forget when I think about my colleagues that I did training with. I honestly forget who went to DO school and who went to MD school until I see their name written out, and then I remember. But no, I don't think not the way there might be in some other specialties. Not at all.
We talked about subspecialization a little bit already with your example that you gave. You said it's basically any subspecialty for internal medicine or pediatrics is open to a Med-Peds doc. Is there anything that's not available to a Med-Peds doc to do a fellowship in?
No, there's not. Although the one thing I do hear people say is that they might do a Med-Peds residency and then do a fellowship that is just within one sphere, like say pediatric ICU, but then practice both in the pediatric and the adult realm. I do see that happen, but no, I don't think there's anything that's cut out. I think, when I was in internal medicine and pediatrics and rotating, most attendings were pretty happy to have us on their teams because they knew we were pretty academic and worked hard.
Are there any specialties that you work very close with as a Med-Peds doc?
I think the things probably most primary care doctors work closely with. So cardiology, I'm talking to a couple times a week. Oncology, a couple times a week. I was on the phone for a while today with them. Surgery. Those are the main ones. Sometimes nephrology. But those are the big ones that I'm talking to on the phone with, on a weekly basis.
Are there any special opportunities outside of clinical medicine for Med-Peds?
I think probably, again, similar to all primary care practices, but, telemedicine, certainly college health, being a volunteer faculty or a full faculty at the university. I don't know reviewers on different journals, but I haven't really looked, much into the realm outside of clinical medicine personally.
Okay. What do you know now that you wish you knew before going into Med-Peds?
This is probably not specific to Med-Peds, but I wish I knew so much more about the business of medicine because I'm a private practice owner and I'm actively learning, but I wish that they taught this in medical school. I wish I got some wiser advice about my student loans before entering attendingship, although, that's coming around and I plan on those being gone in a couple of years. Those are the main things.
What do you like the most about being a Med-Peds doc?
I like being someone's doctor. I like taking care of families, and I love taking care of older adults in their 80s and 90s. I just think there's so much to learn from them, and I love taking care of first-time babies of families and kind of guiding them through that process.
What do you like the least?
Probably the reimbursement compared to specialists. I don't have a lot to complain about. It's fine. But it seems like, it's not that it seems like, it's the fact that we pay more for procedural specialties than we do for those people who, hold their patients' hands and talk to them when something's going on. And I think that we should even out that reimbursement playing field.
You mentioned you're in private practice. What was the decision for you to go into private practice versus academics?
I like having control over my own schedule and over how things run where I am. And honestly, going into private practice versus academics, you get paid more and you have a better schedule. And I think a better quality of life because you get more say over how your practice runs and you're not having an administration tell you what to do.
When you put it like that, it's like, why does anybody go into academics?
I feel that way. I know. I really do. And I've been at my particular practice for 5 years. The first 4 were as an employed physician, which was great. I became a partner last year, and I honestly would never work for someone else for the rest of my life. I was just telling my medical student today who asked me the same question. I just said, last week my babysitter had the flu and I had to go pick up my 3-year-old from preschool, and I worked for myself and I blocked off my schedule for an hour and picked him up, and he came here and did blocks with my partner while I saw patients over lunch. And no one said anything to me about it because I work for myself.
Yeah, that's nice.
Yeah, I think so.
For a student who may now be very interested in Med-Peds, specifically private practice, do you see any major changes coming to the field that he or she should be aware of?
There's this thing called capitation that doesn't impact students, but there's kind of a change in the way that we're paid in private practice. And this is a more regional thing, but a lot of insurance companies are interested in incentivizing you to provide really good care to their patients. But then they kind of pay you per month to be someone's doctor, and they don't pay for sick visits when patients come in. There's good and bad things about that, but there's changes in the pay structure for private insurance right now. So it'll be interesting to see what happens. Overall, with the Affordable Care Act, that has not impacted my practice in a negative way. And it'll be, again, interesting to see what happens with the new healthcare plans.
Yeah, the membership model of primary care is very interesting and being tried in a lot of places.
I think it's great too, but the one population that I love taking care of, again, 80 and 90-year-old patients, they're all on Medicare. Mm-hmm. And for me, they worked so hard, and whether they raised a family or had a job and they're retired, and I want to be available to those patients. So it's worked for now. But yeah, I can't say that I haven't looked into something like direct primary care.
Mm-hmm. If you had to do it all over again, would you still be Med-Peds doc?
100%. Absolutely.
Any last words of wisdom for a student thinking about Med-Peds or maybe loves pediatrics, loves internal medicine, and thinking about either one of those or both of those or family medicine versus Med-Peds?
Yeah, something I think is a really neat trend, and again, this may just be me, but I take medical students from our local state medical school that I went to, and I love seeing that my first-year medical students are networking and connecting with attending physicians and going to shadow them to see if it's something they're interested in. And most of us, especially in practice outside of the university community, we're really excited to share our specialty with people. And so if there's someone that's a family friend or your pediatrician or someone you meet at a networking event for pre-meds, really take them up on the offer if they offer for you to shadow, or reach out because, those of us who are happy in our career, we want to share that with other people who may be interested. And so, reach out and network and take people up on offers if they do offer to let you come shadow.
All right, there you have it. Again, that was Dr. Lauren Kuwik, who shared with us her journey into becoming a Med-Peds specialist. And if that is something you are interested in, hopefully now you have some motivation to go out and find a Med-Peds doc to shadow. If you have any suggestions for physicians to have on this podcast or specialties to interview or go out and find physicians for this podcast, again, number one, if you know somebody, just give them my email address, ryan@medicalschoolhq.net. If you don't know somebody, then go find somebody. go do some Google searching and help me find some more physicians so that I can keep bringing you awesome interviews here every week on Specialty Stories. If you're pre-med, go check out my MCAT podcast. It's the podcast for MCAT prep. As I'm recording this, I just got an email yesterday from a student thanking us for the MCAT podcast. He binge listened. He had just found the podcast like 2 weeks before his test date, binge listened to it, and he got like a 516 or a 517 or something. So I'm going to take credit for all of that. I think it was going to score like a 482 or something without the MCAT podcast. Probably not, but that's what I'll say. So go check out the MCAT podcast at themcatpodcast.com and all the other podcasts we do at mededmedia.com. Have a great week. We'll see you next time here on Specialty Stories.